Well, thank you for joining us for tonight's health literacy webinar. Tonight, we'll take a look at how we can find reliable information when we are online. I'm Greg Berry, Assistant Director in the UAB Office of Alumni Affairs. As is the case with any virtual event, please excuse any glitches or things that seem out of place. If your video or audio stops, click the reconnect button at the top of your screen. This will get you back to the webinar quickly. Now, before I introduce tonight's guest speaker, I would like to go ahead and ask a question. And that question is, how comfortable are you with sorting through the good, bad, and ugly of health information on the web? You have three options to choose from. Go ahead and select which one best describes you. Are you basically screaming for help, not knowing what you can trust? Or maybe you are just making sure you're using the right sources, or perhaps you're a pro when diagnosing your ailments and know exactly what to find and where to find it. I'm going to go ahead and keep the poll up for a moment so you can select which answer best describes your level of online health literacy. After tonight's presentation, there will be time for questions throughout the evening. Be sure to put your questions in the chat box. I'll make sure Megan has a chance to answer them after her presentation. So here are tonight's poll results. 80% of you just want to make sure the sources you're using are credible. The other 20% or so either have no idea of what they can trust, or you're a pro and self-diagnose everything. Thank you so much for going on there and choosing which best describes you. And now I am going to go ahead and introduce tonight's guest speaker. We welcome Megan Bell, Reference Librarian and Liaison to the School of Health Professions here at UAB. Megan earned her Bachelor of Arts degree in biology from Xavier University in Louisiana before getting her Master of Science in Library Science and Administration from LSU. Megan is also a provisional member of the Academy of Health Information Professionals. At this time, I would like to turn things over to Megan. Welcome, Megan.
Hi, thank you for having me.
And you are all set.
All right. So today's presentation is Health Literacy, Finding Information You Can Trust. And I am Megan Bell, one of the reference librarians at the Health Sciences Library at UAB Library. And I'm going to just give you a general overview of where to look for when you're trying to get started to help find some health information. So first of all, what is health literacy? What does that even mean? So health literacy is just when you're trying to your ability to be able to find information and understand what you're reading and be able to take that information and apply it to help you make health decisions for yourself and for those you love. So when we're on our approach looking for information, let's think about this as a microscope versus binoculars. So what comes to mind when you think about using binoculars? When would you use that?
Yeah, definitely would want to see something from afar is when we'll be using the binoculars.
Right. So you usually use binoculars when you want to scan the horizon, versus when you want to use the microscope is when you want to get a very specific, you have something very specific in mind and you are trying to get very minute details. So when you're looking for health information, it's important to kind of have an idea of where are you in your search process? Are you kind of scanning the horizon to get a general overview of the topic, or do you have a very specific question in mind? And that's going to determine where you look for the information. So background information is kind of when you want those binoculars. It's when you want to just get a general overview of what's been published or what information is out there on that particular topic. It's for people who really don't know much about the topic and they want to read an introductory text. So just get a general overview. You can look in medical encyclopedias. You may find some websites that give you a general overview, government reports like the CDC, FDA, professional associations like the Alzheimer's Association and various other professional associations, maybe the Mayo Clinic, things like that. They have general overview on various health topics. So some examples of when you want background question is if you want to have corrective jaw surgery. I was thinking about having jaw surgery recently, or maybe you or someone you know wants to have total knee replacement surgery because you have knee pain, or maybe someone came to you and said, you know what, there's some health benefits to just eating garlic or something like that, or some kind of dietary or natural supplement, and you want to know, well, is that really good information they're giving me? Where can I go to check this information? So when you have just a basic question, you want a general overview, I recommend Medline Plus. It's a free online consumer health information resource. The mission of the website is to present high quality, relevant information that is trusted and easy to understand. So it's written at a consumer level. It's written for the general public. It's not really written for like doctors or physical therapists, people who are professionals. It's written for people who are just trying to make health decisions for themselves. And it is created and maintained by the U.S. National Library of Medicine, which is falls under the U.S. National Institutes of Health. It has information on health topics, human genetics, if you want more information about like genetic things. It has information on that, medical tests. If you went to a doctor and a doctor is recommending you have a certain medical test, you want more information on that, you can go to this particular website. It has information on medications, like side effects of medication, adverse events of medications. It has information on herbal medication, dietary supplements, things like that. It also has healthy recipes, and it's available in both English and Spanish. So this particular website, they don't create all this information. What they do is they compile the information. So they get information from these various resources, like from various agencies, various health agencies, as well as professional associations, and they compile and they put it together under various topics and make it so you can just search for it. So if I wanted to know some information about knee pain, I type it into the search box and it gives me a list of things that match that. For example, you see here, there's an image on it. They give you just various things that may come up. And then you see this list right here of health topics, medical encyclopedia entries, genetics, just drugs and supplements, all that information on that subtopics that come up when I type in knee pain. I also want to point out these up here. You can click on this to see just like a browse through various categories, health topics. Also, you can click here for drugs and supplements. If you know that's what you want, you can go straight there. Genetics, medical tests, videos, and tutorials. So here's a screenshot for drugs and herbs, for herbs and drugs. And so if you want to get more information on a supplement that you're taking, you want to know, the pros and cons of it, what kind of health benefits that it has, you can click on that. Or if there's a drug that you've been prescribed, or maybe an over-the-counter drug you're thinking about taking, then you can check to find out more information about it. Has information on genetics, genetic conditions, genes. You want to know more about gene therapy, you can click here and it'll take you to information on reliable information to get started. Just giving you a general overview to get you started on more information on genetics. And the same thing with medical tests. So foreground information is that microscope type information. It's when you already have a general overview, you know the basics of whatever information you want more information on your topic. But now you really want to know what's the latest research on this topic. I have a really specific question, and I want to know, has anyone done a research topic, a research study to investigate this particular question? And again, when you have a very specific question, and where do you look for that? So you can look in conference proceedings. So scientists and clinicians, they have these conferences. They're perhaps annually, biannually, whatever. And they present on the research that they've done. And they often compile that information and they put it in journals. And then that's made available in various databases. You can also look in journal articles if they did a specific research study and they've written a manuscript and they've published it. Whenever something is in a journal article, it goes through something called peer review, which means that other scientists have read the information and said, okay, yeah, this methodology is good. The information they're presenting, it makes sense. So it's kind of going through a little bit of a rigorous evaluation of what they've written. Or you can also try clinical trials. Even if you don't want to register for the clinical trial, you may find it just helpful to know what are other options, other treatment options that are available. So an example of when you would go to a database to look up information, this is a very specific question. In middle-aged adults, are there non-surgical treatments that are effective in reducing knee pain? So maybe you went to the doctor and the doctor's recommending you have surgery or recommending you take some kind of medication, and you're like, I want to know what other options are out there besides surgery or taking medication. And so maybe you can look in an article and try to see what type of research has been done to answer that question. So where can you go? One option is Pubmed. It's another free resource that's available, and it has information on biomedical and health literature. It is also maintained by the National Library of Medicine, which falls under the National Institutes of Health. So here's an example. If I want to know what are some non-surgical options for the adult population, if they have knee pain, I can just type in those keywords in the search box. And here's some results that pop up. So when I put in those words, I get 180 results. And I can use the filters on the left to help me reduce the number of results or refine my results. I can refine it by publication year. I can refine it by what type of article is it. I can also add in certain filters like for age group or for language, things like that, to reduce the number of results that I'm getting. So when you want to reduce the number of results, you may look at them and say, what am I looking at? So there is something called an evidence pyramid. So when you're seeing the results, just knowing the lower you are on the pyramid, that's the, all the information is good, but the ones at the bottom of the pyramid they're weaker levels of evidence. The ones at the top of the pyramid are stronger levels of evidence. And the reason is because, so for example, the one in the blue at the bottom, that may be that's a written report of what happened to one particular patient, as opposed to if it's at the top in the orange, they gathered multiple research studies on a particular topic, and they're giving you a summary of, okay, these are multiple research studies that were done on this topic, and here's our final answer to this question. So that's why this one's weaker and this one's stronger. So I'm only saying that when you're in PubMed and you see the results, what does it mean when it's a systematic review? Well, a systematic review is a stronger level of evidence to answer your question than if you find something that says it's a case control study. Another option in PubMed is you could use something called the clinical queries option in PubMed, and it's similar in that, but the only difference is you're being more specific when you're looking for information. So you still have some of those basic questions, but now you can add another drop-down menu to say, I want information on one of these categories. So if it was a treatment question, like the question I asked about non-surgical treatments for reducing knee pain, I can put in my keywords and select therapy, and so then it's going to limit the results to articles that are about treatment options. If I want to know about, let's say, I want to know more information on like my diagnosis. So let's say maybe I want to compare a certain type of test that the doctor wants me to have, and I want to see what other diagnostic options are out there, or I want to know the effectiveness of the diagnostic option. I want to know how sensitive or specific the particular test they want to do is. I can look and see. So here's an example. Here's a particular disease. And at this point, when you're looking for this, you have to kind of it's a good idea to start with Medline Plus, so you kind of already know, or either start with Medline Plus, or maybe your doctor has already told you what kind of test they want to do, and you can see like what other options are out there, and then you can maybe look up, see if there's an article on comparing different types of diagnostic options. Another one may be if you want to look at causation or risk Maybe if I were a diabetic and I want to know, and I'm considering having an implant, a dental implant, and I want to know what's the risk of implant failure or bone loss if I get dental implant surgery. And so I can look to see what articles have been published on that particular topic. Or I want to know what's the long-term outcome of getting if I'm a diabetic patient, I want to know what are the long-term outcomes of me getting a dental implant. I can see what articles have been published on that topic. So here's what it would look like after you click on the clinical queries option on PubMed. You'll see the results here on this side are just general clinical studies on the topic, and you click the drop-down menu on what category, what type of articles you want to retrieve. On this side, you have COVID articles, so it's going to limit it to anything related to COVID on your topic. And another option would be clinical trials. So again, this one is it's maintained by the National Library of Medicine, and it has current information about clinical research studies. And it provides a written description of the clinical study, including study objectives, the research design, and may include some background scientific information. And so you can go there if you want to know maybe what you want, some different options for your whatever treatment plan you're interested in. So here's what the screen looks like. So again, I'm looking for information on knee pain, and when you type things in, it gives you some suggestions, and you can choose those suggestions or you can pick your own thing. You can leave it whatever. I just left it as knee pain. Just noticed here that it is a clinical trial, so it hasn't been peer reviewed by other scientists or anything yet, but I look at all the information that I'm giving to you today, like the clinical trials and any articles you may retrieve from PubMed, as a starting point for you to go to your healthcare provider and say, here, I want to discuss this with you. I was kind of doing some reading and I found this information here. Can we talk about this? Or what do you think about this option? So all this information is just some things you can go to your doctor with, your healthcare provider with, and you can kind of have some talking points with them for other options, because as patients, we are involved in our in the medical decisions that we make, and so it kind of helps. I think of it as kind of empowering you to go there with other ideas on treatment options that may be available. So when after you select the search, I did knee pain, it gives me a list of options that match that. I can use the filters on the left to do what kind of study it's going to be. I can also use these tabs to the top. So and click on, for example, by topic, and within knee pain, it's going to group them by what type of knee pain it is, and that can help me get more refined results. Or I can do it by map and see where is the clinical trial and look at it that way and sort it that way. All right, so when it's actually time to get the articles, how do you actually get them? So there are some options. One would be PubMed Central, which is a subset of PubMed. Another thing is open access journals. Open access journals means that the article is free to the public because the author has already paid all of the processing fees that are associated with publishing. And another option is interlibrary loan through your public library. So getting options in PubMed. So when you get that list of articles, you can look for free PMC article. And if you see that, then article's free, and you can have access to the full text of the article. Or you may just see free article, and then you can actually see the full text of the article. And so once you click on that, it'll take you here, and then you just click free article, and you're able to get the full text. So what if there's an article that you think would really answer your question, you want to read it, but it doesn't say free? So if that's the case, you'll see something like this, And your option is to do interlibrary loan through your public library. So interlibrary loan is a process where a library requests material from another library, and it's going to vary depending on where you are. Every library is going to be a little bit different, but basically what you do is you take the article information, like the title, the author, where it's published, the volume issue information, page numbers that you need, and go to your public library and ask them to, tell them you want to do an interlibrary loan request. And they can submit the request for you. Again, it's going to vary as far as how long it takes, and it's going to vary as far as sometimes it's free, sometimes there may be a small fee associated with it. And do you have any questions?
So we'll get those questions going in the chat box. I'll get the ball rolling right away for you. So we went through all of that, and I saw different dates here and there. How important is it to have a more recent article to look at that to really get good information? Does it really matter, or doesn't it really matter when it comes to what year, what date it was published?
It sort of depends on the topic, but usually with the health sciences, you do want to go with a more recent thing that has been published. But it's going to depend on, what you're looking for information on. I mean, I certainly probably wouldn't go with something that's 20 years ago. Usually a lot of the professors here, they tell the students to pull things within the last 5 years. So that's probably at least your best starting point, to go with the last 5 years. And I think to look at it as just a way to, something for you to bring to your healthcare provider to have a talking point with them. And you can say, look, I found this article on this particular topic. What do you think about it?
With you working in the libraries, what kind of access do UAB graduates have to resources within the libraries?
So due to our license agreements with the vendors, the off-campus electronic access is available for current faculty, staff, and students. So once they graduate, they're not able to have access to it anymore. I'm not exactly sure how long, maybe 6 months, maybe 3 months or whatever. They don't have access, which is why I presented information on getting the free resources and going to their public library and to get access to the articles.
Go through just real briefly some of the more credible sources. Again, I know that Medline Plus was one of them that you mentioned. What are some of the other big names that people should be looking at in order to really find good sources that they can work with?
Pubmed would be one, definitely. It's a free resource. It's one that the people tend to use often here at UAB, so that would be a big one, would be Pubmed.
How up to date are the online databases and the articles, and referencing COVID? Because with COVID, with the relative new onset, would they be under all of these as well?
Can you repeat your question?
With how up to date are the databases and all of the searches? Because COVID is obviously relatively new. Would they be included? How often are they updated?
Oh, okay, so I would say updated. I would say PubMed's updated probably. I mean, it's going to vary, but I would say minimum monthly, but it could be daily. They're adding new things to it.
Okay. There are a lot of fad diets out there. Is there anywhere to get information on it if they're safe or not?
Okay, so I would still recommend starting with Medline Plus to get that information and typing in the diet that you're looking for, and probably starting there. If it doesn't pull up on Medline Plus, it does. They do have information on Medline Plus on how to evaluate health websites, and so you can just go to Google, type in whatever diet you're looking for that you're interested in, and use that criteria that's listed on Medline Plus on how to evaluate health websites. So
when you're using Medline Plus, how precise do you have to be with your search? Can you include words in there that might be dropped off in the search, or do you have to really look at things specific like sprained ankle or something like that?
When you're I would probably start, I would just probably start specific and see what you get, and then maybe go broader. So if you try to put in a sprained ankle and you're not really seeing what you need, then just try, ankle pain or something like that. So I probably start specific and then go broader. Okay.
What are some red flags to look for from other sources other than the ones that you presented?
So some red flags would be, do they have an About Us page? So that they tell you where the information is coming from? Do they have, you want to evaluate their, why are they presenting that information? Does it seem, for example, do they have, like, are they getting funding from someone? If they're promoting a particular diet or a particular drug or something like that, are they getting funding from that? You want to look for their, do they have the last updated page? Usually that's supposed to be at the bottom of the page to tell you, do you want to make sure you're getting, if it's health information, you want to make sure there's updated information. So has it been, does it say last date reviewed or last date updated? You also want to look for what makes that source a credible source. Like for example, whatever information they're giving you, are they saying, are they a reliable source? So like if it's, who is the person? Do they have a health sciences background? Like for example, if they're giving you nutrition information, are they a dietitian? If they're giving you health information, are they a physician, or are they, are they qualified in that particular area that they're giving you information about?
Okay. I'm going to go and slide through. Somebody's asking to go back over the pyramid. But as I go back there, are there any tips on searching beyond just linking terms with and how can you exclude terms or limit the search to a region?
Okay. So when you say region, you mean a region of the country?
I would assume so.
Okay. So when you're doing the search, you use or between similar concepts, and you use and. In fact, can I just, okay, is it okay if I just share my screen?
You sure can.
Okay. Okay. All right, are you seeing the Pubmed screen now?
Yes, we are.
Okay. So, so there, and if I could do, say I want to do non-surgical or non-medicine, something. So I'm telling the database, I want you to pull in anything that says non-surgical or anything that says non-medicine, in addition to pain. So it's going to automatically, this space is going to put, well, it's going to automatically put an and there, but it's going to put an or, but I'm using or here. So that's something else you can do as a way to kind of expand your search. If you think of other synonyms for what you're looking for, you can try that. Or another way, let's say you were looking for, let's say you wanted to know if, I'm having knee pain and I'm thinking about, I heard that maybe if I try some kind of exercise, it can kind of help me with the knee pain. So I can try exercise, or every article may not say exercise, so maybe you can try physical activity.
Okay.
And you can do it, put it in quotation marks, because it tells the database to put it together, to search for the words together. Or I can say, sport, and put an asterisk there. It'll pull in sport singular or sport plural, or yoga or whatever, and
okay.
And you put in search, and you can see you're getting a whole lot of results. But I can use my filters on the side to reduce the number of results. But every time I put or, I'm telling it to pull in any one of those words.
Yep, you're adding to that list.
Right. Okay,
I'm going to go ahead and share the pyramid again. Go back over this pyramid so people can better kind of understand it, because obviously the Cochrane database, the database of abstracts of reviews, those are all good ones. And then down at the bottom, it's a little less more credible, correct?
No, it's still credible. It's just weaker. But I do want to go back. You also mentioned about how to limit by region. So if they want to limit to region, they could also just add in regional terms. So like if they're in the Northwest, well, putting in things like Northwest, Southwest, that could be anything. So you could say something like, United States, or put in the name of your state, or you could put in some of the major cities, and that would kind of, and that way if that word came up in the article, the title of the abstract, it would retrieve those articles. But
so how far? Go ahead.
Oh, all right. So here, okay. So the case report is still credible information. It's just that if it's a case report, that's only one patient. So it's a report that they're writing on a case study from one patient. So, when you think about that, it's kind of weak because it's only one person, right? As opposed to if it's a systematic review, those are studies that have been done on, those are multiple studies. They may have found 20 studies on that particular question, and they are doing something called, they're critically evaluating all 20 studies they found on that particular question, and they're doing, they're going to write an evaluation and say, yeah, well, this particular study was a randomized control trial, which means that they found, they took a random sample of people from the population that had that particular condition, and they gave them this particular treatment compared to this particular treatment. And so it's a more rigorous study. So it's still all good information. It's just that because of the way the study was done, the results are more, can tell you more information about that particular, to answer that question.
So it's more like good, better, best.
Right, exactly.
Okay. This question was kind of answered, but the second part may be a new topic, or at least we can go a little bit deeper on it. How far back are articles no longer relevant? This person had a class where the professor only wanted them to find articles published in the last 15 years. How do you recommend finding the most recent reputable article? You mentioned 5 years is kind of the window you're looking for. So how do you find the most recent reputable articles?
So I would just say when you're searching, see what, just look at the years of the things that were published and kind of just go from there. And I don't think there's going to be one answer. I don't think there's going to be one magic number. It's going to depend on topic. It's going to depend on how much research has been done on that topic. And yeah, it's going to vary by topic.
Okay. So just because we can, where's the worst place to get info? Is that WebMD or something like that?
I mean, I wouldn't say that. I can't say, WebMD or anything. Again, I just think that the important thing is, I don't think for me, it's not about like creating a list of like, this is the blacklist, or this is what you don't use, and this is the gold standard list, this is what you do use. Instead, it's about knowing the principles of what to look for to evaluate the information. So again, going to that About Us page and seeing who's given this information, and looking to see, do they have things like a lot of advertisements on the screen, and do they have things like, is the person giving you the information, do they have a background in what they say they're studying, and do they have a background in the information, the advice they're giving you, do they have a background in that? And it's, let's see what else. How recent, has it been published? How recent has it been reviewed at the very least, or updated and things like that? So those are the things to look for.
Good deal. Any closing words before we wrap up?
No, I don't.
All right. Well, thank you so much. This has been a good look at health literacy and seeing what we should be doing and where we can find even good, better, and best when we're looking at all this. So thank you so much for joining us tonight, Megan.
All right, thank you.
And for everybody that is here tonight who attended, just a heads up, a recording will be made available tomorrow on our website. Our office, meanwhile, has a lot coming up, including our annual scholarship run presented by Viva Health. It's the 15th annual run. Join us virtually from Friday, April 23rd through Monday, April 26th as we support scholarships at UAB. We have a 5K, 10K, and non-running options for those of you who just want to sleep in. You can register for all of these by going to alumni.uab.edu/5K-10K. Are you ready to get out of the house when it's safe? Join us for a special virtual night, to check out what trips we have set up through our partnership with Colette Travel. On March 15th, get more information on trips to Portugal, Costa Rica, and Holland and Belgium. Those are going to be later this year and early 2022. You can register for that at alumni.uab.edu/travel. Meanwhile, you can register for the following upcoming webinars that we have available. On February 25th, we're hosting Backpacks to Briefcases, Blazing Ahead with Legacy Credit Union, where we'll learn how you can do basic budgeting, building credit, and looking toward the future. Then on March 4th, join us for How Can You Achieve Lifestyle Wellness with Dr. Holly Wyatt. She's going to reveal a never-before-seen initiative from the Department of Nutrition Sciences. We'll be taking a look at UAB's oral history collection on April 6th. This is a chance to hear more about the history of UAB, Birmingham, and Alabama. I'm really looking forward to that one as a history guy. On April 14th, we'll have another in our Backpacks to Briefcases series as we learn how we can build our personal brands. And finally, on April 22nd, join us to find out what the latest science says about living longer, healthier lives. All of these can be found at alumni.uab.edu/events. Need a podcast to listen to throughout your day? Who doesn't? Listen in to ours, UAB Green and Told. New episodes are released every other week with conversations from members of the UAB community. Find and subscribe to our podcast on Spotify and Apple Podcasts, or visit alumni.uab.edu/green and told. And be sure to stay on top of all things alumni on social media. We are at UAB Alumni on Facebook, Instagram, and Twitter. You can also look us up on LinkedIn by searching UAB Alumni Career Community. And finally, if you want more information about the National Alumni Society, visit us at alumni.uab.edu or email alumni@uab.edu. So once again, thank you so much for joining us for tonight's discussion with Megan Bell. It's been very informative. Have a great evening, everybody. And as always, go Blazers.